The challenges that we have, and now I'm talking not only positron emission tomography, but for instance in magnetic resonance, is the availability of techniques and the cost of these techniques. Because as I mentioned before, we are aiming at having all the process of identified patient more effective, because there are costs related to the drugs, but there are also costs related to the availability of these advanced imaging modalities. And one of the problems that we also have is that there is not yet evidence for some of these technologies, MR and positron emission tomography, that they can be really effective on large number of patients, because designing clinical trials might be difficult, and one of the problems that we as imagers have is that recruiting patients for just pure imaging trials is quite difficult, because the patient, they do not have any clear benefit from themselves. And secondly, another problem is that in Europe there are different rules for the licensing of radiopharmaceuticals. In some countries it's very easy to get access to some radiopharmaceuticals. They might have compassionate use. In others it's very difficult to have access to these new radiopharmaceuticals. And this is hampering the development of these new imaging modalities, or at least it's underlining that there are inequalities between the different European countries. So this means that patients, many times they have to move, or they cannot have access to a particular technology that might be able to treat them in a better way.